She is one of the most beautiful women alive. A famed humanitarian, actor, director, Mrs. Brad Pitt, a mother of 6, and now she is the public face of cancer prevention. Angelina Jolie revealing she had her ovaries and fallopian tubes removed last week, a preventative surgery after doctors discovered what could be signs of early ovarian cancer, the very disease that killed her mother. The procedure coming just 2 years after Jolie underwent a preventative double mastectomy. The Hollywood superstar is sharing intimate details about her life, writing in the New York Times that within hours of learning the news from doctors, her famous husband was on a plane from France, racing home to be by her side. And as she waited for medical test results, Jolie says she lived in a haze, attending this soccer game 3 days ago while trying to stay calm and focused.
Brad and Angie love planning family outings, spending time at their kids' soccer games on the weekend, taking them out to family-friendly restaurants, and that's exactly what she did during those days that she waited for her results.
Jolie writing, "I will not be able to have any more children, but I feel at ease with whatever will come." One of the world's most famous faces going public with a very private decision. For Good Morning America, Cecilia Vega, ABC News, Los Angeles.
Our thanks to Cecilia. We know you have a lot of questions. So joining us now from Los Angeles is Dr. Christy Funk. She is the surgical breast specialist who performed Angelina Jolie's double mastectomy and the founder of the Pink Lotus Breast Center. And with her is ABC News senior medical contributor Dr. Jennifer Ashton. Glad that you are both together. Dr. Funk, it's good to have you back on our program. And we talked to you before, and there are so many people that are asking why it was right for Angelina to have the second procedure now after the one you did some years ago.
Well, you know, when BRCA carriers don't yet have a known cancer, they have a little more flexibility with the choice of doing breast versus ovary first. And in Angie's case, she knew that her ultimate risks for breast cancer were higher than ovarian, and also the operation to remove breasts, because of the reconstructive process, is about start to finish on average 3 months. So circumstances in her life just worked out better 2 years ago to move with the breast first, and the time was right now to do the ovaries.
Right, and you're right about the procedure. The double mastectomy, all that went into it was much more time-consuming and other factors. And Jen, you were talking yesterday as a gynecologist. You have done the procedure that Angelina Jolie just recently underwent.
Right, Robin, and it's called a BSO. It is minimally invasive surgery. Usually it's done laparoscopically through tiny little incisions in the belly, and it's generally low risk, but it's not zero risk. There are the routine surgical risks: bleeding, infection, damage to internal organs, and then of course with the removal of the ovaries and the entire fallopian tube, there's immediate menopause. And it's new information in the GYN surgical field that the key is really getting that entire fallopian tube, since that's where many cases of ovarian cancer actually start.
Yes, when you said that yesterday, it really raised a lot of eyebrows. And Dr. Funk, another thing that people have really zeroed in on is when Angelina said about how it has put her into forced menopause. How is that different from regular menopause?
Well, when menopause is forced, you bring it about almost instantaneously. The ovaries are responsible for spitting out all of these hormones, estrogen and progesterone, and when you remove them, you remove all those hormones in an instant. So she wakes up menopausal, as opposed to natural menopause where your ovaries sort of peter out over time, months to years, so you have a little heads up on the symptoms.
And so what is the treatment for menopause? I know a lot of women are leaning in for this one.
A few different choices. I mean, okay, so choice number one, I'll lean back, is to just embrace menopause with all you got and go for it. But short of that, there are non-hormone remedies through acupuncture and herbal supplements. But the majority of women who undergo a BSO prior to age 50 will opt for hormone replacement. So that comes in different forms: pills, creams, vaginal suppositories, patches.
And we really were quite touched and moved in many ways from what Angelina Jolie wrote, and she was pretty much saying, you know, this was her choice. And she also, Jen, she mentioned there are other options, and you talk about that too.
That's right. And you know, for any woman facing any kind of a big decision, like this type of surgery or any surgery, you always have to consider a few things. What are the risks? In this case, what are the risks of doing the surgery, and what are the risks of not doing the surgery? In her case, about a 40% risk of developing ovarian cancer at a young age. Then what are the benefits? The benefits of doing this surgery, very clear. A big study showed that women with this genetic mutation who had their tubes and ovaries removed faced a 70% reduced risk of death by the age of 70s, so that's huge. The benefits of not doing the surgery, no immediate menopause, and then options. As you said, there are always options, and there are options even to reduce the risk of ovarian cancer. We know that taking birth control pills lowers the risk, and that's what's important.
And
removing,
go please.
I was going to say, removing ovaries prior to age 40 cuts breast cancer risk in half for BRCA carriers.
I know that's very important to you to get that information out. And just really quickly, insurance, because people want to know the testing and the procedures, how much is covered by insurance?
If you meet criteria, even if you don't have insurance, you can get the test and you can get the surgery.
All right, Dr. Funk and Jen, thank you very much. We certainly appreciate all your insight and suggestions this morning. Y'all take care.
Thanks,
you.
Robin.
And we posted the answers to your most commonly asked questions about this story on our website at goodmorningamerica.com on Yahoo. David?
All right, Robin, thanks very much. That's the biggest gift that Angelina Jolie just gave, is this conversation now that we're all having for women across the country.